Hi there. My name is Dr. Late Night. Do you have an appointment with us this evening? Okay, wonderful. If you'll just give me your full name. Okay. And your date of birth. Okay. And your home address. Okay. Okay, perfect. And it looks like you're here for a cranial nerve examination. Okay, wonderful. If you'll just give me a moment to set up and then we'll begin. I'm going to begin by checking your vital signs. Alright, sorry, might be a little bit cold. If you'll just breathe in for me. Breathe out. Breathe in. Breathe out. Good. Breathe in. Breathe out. And breathe in. Breathe out. One more time. Breathe in. And breathe out. Okay, wonderful. Will you go ahead and put your wrist out for me, and I'm just going to check your pulse very quick. Okay, perfect. I was also counting your respirations as I did that. Everything seems to be normal. Now, beginning at the top of your head, I'm just going to look at you, checking your face to make sure that it is symmetrical. And there are no obvious abnormalities. I don't see anything wrong. Okay, you have very nice skin. Perfect. And then I'm just going to feel your hair here. Just checking for any lumps or bumps or anything. Do you have any problems with your hair? Any scalp dryness? Just any problems at all? No? Okay. Very good. Okay. Moving down to your ears, I'm just going to palpate around your auricle on either side. And also looking just in the ear canal a bit. And around the back. Okay, good. And this other side here. Around the auricle. Looking inside. And pulling it back. Very good. Now I'm going to move on and test your vision. I'm going to conduct a few different tests here, alright? So I just want you to focus your eyes on my finger. Good. And just follow it as it moves around. Focusing only on my finger. No cheating. The side. On the other side. Wonderful. And then as it goes out, back in towards you. Perfect. Alright, now I'm just going to have you look straight at my nose, okay? And I just want you to tell me if one or two fingers wiggle. Checking your peripheral vision here, okay? Looking straight at my nose. 1, good. 2. 2, good. 1. 2. 2, good. 1. 1. 1. 1. 2. Very good. I'm going to move on and test your pupils. So I'll be testing your pupillary reaction to light and also assessing the size with this chart right here on my pen. Alright? Beginning on the first side, just look straight at my nose, okay? Okay. Very good. And the other side. Looking at the size there. Okay, very good. Pupils react to light and accommodation accordingly. So we're going to move on now. And I'm going to test your visual acuity, alright? So I'm going to have you read the lines on this card. See how far down you can get on either side. So if you'll just cover one eye to begin. Let's see. Can you read line 1? Good. 2, 3, 4. Can you make out 5 for me? It's a little harder. Good. And then finally the last line, 6. Okay, wonderful. Now switching eyes. I want you to read number 1, 2, 3, 4, 5, and 6. Wonderful. Now if you'll go ahead and cover your other eye again, and just go ahead and look and tell me if this red looks the same on both sides. So going from one eye and then covering the other. Does it look the same on both sides? So if I said that on the right, this is $1 of red, how much red is it on the other side? $1. Okay, very good. That's what we like to hear. Now moving on, do you have any issues with your sense of smell? Or any problems with sinus infections? Anything to do with your sinuses or your nose? Okay, good. I'm going to go ahead and just palpate your sinuses under your eyes and above. Any tenderness there? Okay, very good. And now, if you'll just tip your head back a little bit, and I'm just going to look in your nose, okay? Alright? Very good. Everything appears to be normal in there. Now, if you'll just cover one nostril and breathe in and out for me. Good, and the other side. I have a couple essential oils for you, so I just want you to close your eyes, plug one nostril, and take a sniff of this. Can you tell me what that smell is? Okay, very good. It's rose. Retrieving another essential oil here. If you'll just swap over to the other side, keeping your eyes closed, okay? And give this a smell. Good, that was jasmine. In your day-to-day life, are you able to taste things like salty, sweet, umami, spicy, all those different tastes? Okay, wonderful. Now I'm just going to take a quick look in your mouth, if that's alright. If you'll open wide and say, ah, I'm going to press your tongue and just take a look. Say ah for me. Good. The uvula is midline and moves according to your ah. I don't see any cavities or anything else to be concerned about. Okay, wonderful. Now I'm going to have you taste a little something with your eyes closed, but I should ask first, do you have any allergies? No. Okay, wonderful. So if you'll just close your eyes and stick out your tongue. Sprinkling something on there. And what does that taste like? It's sugar. Very good. Next, we're going to test your facial sensation and the muscular function in your face. So if you'll just do some facial movements with me, I'm going to have you raise up your eyebrows and furrow your eyebrows. And then puff out your cheeks. And keep them puffed. I'm just going to tap. Perfect. Okay, now give me a pouty face and a smile. Good. Now, if you'll just stick your tongue out and move it side to side. Very good. And then just press your tongue into the side of your cheek, and I'm just going to press against that on this side and on the other next I'd like you to do just some basic head and neck movements for me. So if you'll just put your head down and all the way back, center, to the side like this, and the other side. Good. And then just tipping your head down to the shoulder and to the other shoulder. Very good. Do you have any problems moving your neck in a circle? Just give me a couple neck circles. Okay. Perfect. Now I'm going to test your facial sensation. Alright. So I have just this little wisp of cotton, and I'm going to ask you to close your eyes. I'll be touching your face on either side, and I want you to tell me if it feels the same on both sides. Actually, I suppose you don't have to close your eyes for this. Just relax. Your forehead. It's the same? Okay. And on your cheeks. Very good. And then down by your jaw. Feels the same. Okay, perfect. Now I will have you close your eyes here, and I just want you to tell me where on your face I'm touching. So either the right or left side. It'll be your forehead, your cheeks, or your jaw. Okay. Close those eyes. Forehead, good. Your cheek. Your jaw. Forehead again. Cheek. Cheek. And jaw. Wonderful. Alright, keeping your eyes closed now, I have this empty pen here, and it has just a slightly pointy side and a dull side. So I just want you to keep your eyes closed and let me know if you feel the sharp or the dull end poke you, okay? Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Okay, wonderful. You can open your eyes again. Now moving on to your ears and testing your hearing. I'm first just going to take a quick look at the inside of your ears. Okay, this one looks good. The other side. Looks good. Now for your hearing tests, I am going to have you close your eyes again so that you can't cheat on them, alright? So close your eyes, close your eyes. Now I'm going to whisper a phrase or word into each of your ears, and I just want you to repeat back that word or phrase, okay? ASMR is awesome. Good. Sleep well and have sweet dreams. Wonderful. Now I just want you to tell me if you hear my fingers fluttering on the right, left, or both, okay? Keeping your eyes closed. Good. Very good. Okay. Good. Perfect. Wonderful. Okay. Very, very good. I'm going to continue making sounds by your ears, but now I just want you to tell me which of two sounds is farther away from your ear, alright? Number one or number two? Very good. Very good. Okay. Good. Wonderful. My final hearing test for you, again, keeping your eyes closed, is going to be a tuning fork. I'm going to strike the tuning fork, and you just let me know when you can no longer hear it, alright? Good. And again. Good. One more time on each side, alright? Wonderful. Alright, you can open your eyes again. Welcome back. You have done very well on this cranial nerve exam. I haven't found anything to be abnormal with you at all. If you're still feeling sleepy or dazed, which some often do after a cranial nerve exam, you're welcome to lay down on a couch in our lobby until you feel prepared to go. Okay? Thank you so much for joining me tonight. You're welcome back anytime at the clinic. It's wonderful to see healthy people coming in. Alright. I hope you have a wonderful night.